crowns, as I explained to patients, when a crown's needed is when, I believe that when more than half the tooth is missing, whether it's fractured or whether it already has an existing filling that's more than half the tooth and there's new decay. At that point, that's kind of when I'm going to recommend that we put a crown on the tooth, which is something that covers the entire tooth. The benefits to a crown is that it holds the tooth together. And as long as they're really good about taking care of it, there's a good chance that that could last a lifetime, especially if it fits as it should be and everything's done correctly. The porcelain, plaque and stuff doesn't tend to stick on crowns as it does our natural teeth. So in placing crowns, though, it's really important that they be placed, slightly below the gum line, in my opinion, so that they get the correct look. They look more like a natural tooth. The profile, how they emerge out of the tissue, is like a natural tooth would. And that's something that you can achieve with crowns. Now with bridges, bridges are great for when there's a missing tooth. Nowadays, of course, we have implants. Sometimes, in my opinion, I think patients are sometimes pushed towards implants when implants weren't necessary, meaning that, in a situation where I believe in fully giving a patient all their options and the pros and cons of all those options. And many times with the bridge, if you're missing a tooth and the teeth on either side of that space are perfect teeth, I would really love to see the person go with the implant, because the last thing you want to do is go grinding down or taking down a tooth or working on a tooth that doesn't need anything done to it. Now, another situation might be where the crowns or the teeth on either side of the space need crowns. They already need a crown, so they need to be restored anyway. Now, in doing a bridge, that would occur. You'd not only fill the space with a tooth, but you'd be taking care of two teeth that needed crowns anyway. Now, if they didn't have any concern about being able to floss underneath where that tooth is sitting on the gum tissue, then that would be an option for them. That would be it'd be less expensive than going the implant route, and it'd also be less invasive. So there again, possibly taking the age of a patient in. Not something that I'm going to tell them, that I don't base treatment on age, but it's something that they might choose to do. And that if their tooth needed work, they really don't want to have a surgical procedure done, and they really don't want to wait 10 months to have the implant restored. That's something that can be done in a matter of, as long as the tooth's been missing for a while anyway, they could have that done in 3 weeks. So a lot of it times comes down to the time, patient preference, cost, and I think it's really important to review, because a bridge, it works great as long as it's done correctly, but ultimately to go all those, and then so that final option is ultimately the choice of the patient. I'll go through with them and prioritize what I would recommend from best to next and go through that with them. But then ultimately they need to take into account some of the things that, what's important to them, affordability, other types of things, and then come into a mutual agreement that what they've decided on and what we're going to do is going to be of a benefit to them.